This is Hemang Panchal. Today we are discussing a case on bifurcation STEMI involving LED and diagonal branch. Disclosures: none. We had a 52-year-old male presented with chest pain of 3 hours origin. Patient hasn't seen a physician in years. His known risk factors included hypertension, he was still smoking, male gender, and age. EKG was done, which showed acute anterior and lateral elevation myocardial infarction. We did a diagnostic cath first using 6 French sheath in the groin. We used 5 French GR4 catheter to engage the RCA, which showed mid RCA about 70% stenosis, and the ostial PDA and the mid PDA has disease. We used 5 French GL4 catheter to engage left vein coronary artery. The angiogram showed completely occluded mid LAD with TME1 flow to mid to distal LAD and the diagonal branch. We used 6 French XP 3.5 guide to engage the left vein. Again, the angiogram showed occlusion of the mid LAD with TME1 flow downstream into mid to distal LAD and diagonal branch. I passed a workhorse wire into the diagonal branch. Using the over the wire balloon, I tried to pass a workhorse wires down the LED, which was unsuccessful. Therefore, I used the hydrophilic wire to cross the lesion in the LED. I used over the wire 1.5 by 15 mm balloon to pre-dilate the lesion in the LED, followed by 2.0 by 10 mm balloon. I used that same balloon to pre-dilate the lesion in the diagonal branch. Then, keeping that balloon inside the LED, I passed a 2.25 by 34 mm drug-eluting stent into diagonal 1 branch. I positioned the stent into the diagonal branch. I deployed the stent in the diagonal branch. Following that, I pulled back the stent balloon and flared out the ostium of the stent, and then I used the 2.0 by 10 mm balloon in the LED to crush the ostial part of the diagonal stent hanging into the LED. Here is a scene of the diagonal stent after deployment. Then I passed a 2.25 by 38 mm drug-eluting stent in the LED for bifurcation stenting, and I deployed that at high atmosphere. This is the image after the deployment of the LED stent. I pulled out the diagonal branch wire and recrossed into the diagonal branch across the stent strut. Then I used 2.0 by 15 mm balloon in the diagonal branch and 2.25 by 10 mm balloon in the LED branch to perform final kissing. This is the final angiogram after kissing balloon angioplasty. There is still a lesion in the ostral LED which continues in the distal left vein as well. I performed an FFR across this lesion which was 0.96 before the regadenoson and 0.89 after the regadenoson at 2 minutes. Left that for medical management. Although FFR is not validated in the STEMI, we still decided to leave it alone at this time because it looked more like an intermediate lesion. The RCA lesion was staged 2 days later when we shot the left side again, and this is the final picture on the left side 2 days later, and you can see the distal LED is very short, but it looks much better than 2 days ago, and the bifurcation stenting looks great. Thank you. If you have any question or concern, please leave a comment.